Welcome back to Sage Connections. Today we are talking about something so many parents are living every single day, often quietly and with a lot of unanswered questions. We are diving into the intersection of trauma and neurodivergence, especially ADHD, and how these experiences can shape a child's behavior, emotions, and nervous system. So many parents are given a diagnosis, but still feel in their gut that something deeper is going on. Behaviors get labeled, meltdowns get misunderstood, and families can end up feeling overwhelmed, discouraged, or unsure of how to truly help their child. This conversation is meant to slow things down and offer a more compassionate and informed lens for understanding what is happening beneath the surface. Today, I am excited to be joined by Dr. Hasti Raveau, PhD and licensed psychologist and owner of Mala Child and Family Institute. She works closely with children and families using a trauma-informed and neurodiversity affirming approach, helping parents better understand how a child's nervous system communicates through behavior. My hope is that today's conversation brings clarity, validation, and reassurance to parents who are doing their very best and want to support their children in a way that helps them feel safe, understood, and regulated. Enjoy. How do you define trauma in children, and how is it different from how adults experience trauma?
Trauma is such a complex term and it captures so many different things. I think historically, when we think about trauma, we're associating it with somebody who went to war and came home with PTSD, or somebody who was maybe sexually assaulted or lived through domestic violence and now they have PTSD. And so that is the one end of the spectrum where the individual loses their overall functioning. It affects their overall way of living day to day, from the nightmares they're having and intense hypervigilance and difficulty focusing, and they become extremely depressed and anxious, and they can't control those recurrent thoughts. So that's on one end, right? And then there is these what we call little T's, the little traumas that happen for a lot of people, especially if you're a vulnerable population. So, for example, um, you know, uh, growing up in a household where emotional vulnerability was not available, having parents who are emotionally maybe immature, um, being somebody with a disability and going to the school system and nobody's acknowledging it, you're not getting the support, for example, that you need. Um, just knowing that you were not born in the body that you feel that you belong to, and that the whole world wants you to be, somebody that you're really not, right? And then so there's like all these things in the middle, and humans were designed to be able to be resilient and to cope with stressors, to cope with life and persevere anyway. And we know certain factors that make us more resilient despite stressors. And then we know certain factors that reduces risk for mental health issues and even physical health issues as a result of those stressors that we experienced.
So, in your work, how often do you see, well, I guess before that, um, there's this concept of ACEs, right? Adverse childhood events. And so that includes, alcoholism in the family, child abuse, or like abuse as a in childhood. Um, I can't remember
Poverty.
poverty, right? Yep.
Mhm.
Um, that would you categorize that as like the little t? And then what would make somebody, because you see people coming out of poverty and they become very successful in both, financially and in relationships, and some people spiral the other way. So what makes somebody more resilient to those?
Well, those are systemic traumas, right? So growing up in a household where your father is an alcoholic, that's a systemic trauma, and that's a collective trauma you're experiencing with other family members, right? Poverty is a systemic trauma. right?
Mhm.
Um, as a mental health provider for us, it depends where we're working. I trained in Detroit, and so I was, the average kid and teen and family I was working with had really high levels of PTSD. We actually conducted a family-focused research study. These were families that had toddlers, and we screened for PTSD, and both parents were reporting such high levels of PTSD that it impacted our findings because you need to see some variability. So you can say, the more of the symptoms, then more of this. But if everybody is reporting such high levels, then you can't find that relationship, right? And currently, my three clinics are in Plymouth, Farmington Hills, and Ann Arbor, Michigan. These are highly privileged uh, communities where we are not seeing those same things. So when it comes to the topic of um, risk, Gabriel Mate, I think, once said that trauma isn't what's happening to you, but it's what's happening inside of you when that thing is happening to you.
Mm.
This is why two people can go through very similar things, and the way it metabolizes in their body and mind can look really, really different. So our temperament matters. Some of us are born just more sensitive, more anxious, That anxiety can be adaptive because we might then work really hard to avoid risk, and that can be helpful. But if that doesn't happen and we keep experiencing traumatic events, then it's really increasing our risk for PTSD. Um, and then there's, I think vulnerable populations that because of that, like women and LGBTQ and folks who are neurodivergent, just differently wired, they're at much higher risk of being even exposed to traumatic events. And so the accumulation of it kind of builds up, you know?
Okay.
And so that's one. That's one. Just having a sensitive temperament without somebody, one person on the outside that you can tune into and they can tune into you. And that is a huge risk factor. Kids really need one secure attachment, one person they feel safe with, one person that can really tune into their needs. And that is really protective against traumatic things happening. And in the absence of that, that really increases risk, not just for PTSD, but for depression, for anxiety disorders, for substance use, and lots of other things, sleep disorders, other stuff.
Yeah. So
Yeah.
in your work, how often do you see trauma and neurodivergence? So specifically, ADHD overlapping.
Well, my entire institute is probably possibly the only multidisciplinary training center in the state of Michigan that is known for being as a whole neurodiversity affirming. So we get a lot of clients coming to us who are neurodivergent. They have, their ADHD, autism, gifted, double exceptional, and everything in the middle, right? So the average person coming to my organization has a higher chance of having ADHD. Now, are we asking what is the likelihood that this person also has PTSD? The population that we're serving, because they are a lower risk population, the likelihood in our setting is low. But if you go to another population, those numbers are very, very different. The comorbidity of seeing somebody meet criteria for ADHD and PTSD really goes up. And other things, especially for children, like oppositional defiant disorder. And in the school system, even in the healthcare system, because people are not properly trained about trauma and being trauma informed, they misdiagnose kids all the time.
Yeah. So, speaking of Gabor Mate, you had mentioned him. He mentions that the link between trauma and ADHD is the fact that it's kind of a maladaptive. The ADHD becomes sort of an adaptive technique for when you're a baby and you can't, use your fight or flight sort of response. And so you go internal and then you stop paying attention to the external world. And then as you grow up and you are able to leave a situation, the ADHD becomes sort of a maladaptive strategy. Can you speak to that?
Mm. Well, if you are a baby or a child in a really stressful environment where there is kind of just chronic cortisol levels are high, right? Um, your oftentimes your amygdala, which is a small part of the brain sitting in the back, is actively on. And when our amygdala is chronically on, it what the signals it sends to the rest of the body is to have the blood flowing to our skeletal system, to the muscles, away from the frontal lobe. Because adaptively, it's like there's some level of danger, and at any moment, I need to pivot, I need to move, I need to fight, I need to flee. So what we oftentimes can see with in humans that were chronically very stressed out is possibly that either they have an underdeveloped frontal lobe, which is needed for focus, attention, problem solving, emotion regulation, flexible thinking, or it's very selective. That in areas in which it was adaptive for them, they can really hone in, regulate, focus, push through, but that in all these other domains, they really can't. Now, ADHD is highly genetic. There's a 40% chance if you have it, one of your parents meets criteria. But we do see this kind of developmental pathway through which children who experience a lot of trauma then meeting criteria for the ADHD because of the impact of the trauma on their brain.
So we were talking a little bit off camera about everything that's going on in the world, everything that's going on in Iran and the Middle East and now Venezuela. We can go on and on.
Mhm.
What happened? Is there sort of predictive th or things that can be predicted about a child's mentality or coping mechanisms that grow up in this? So let's say there's a little person in Iran right now who's like 7 years old. Sort of how is their nervous system reacting to what's going on? How does that affect how they could potentially, grow up, what kind of adult they would grow up into, and what strategies could people implement to give them resilience? Because obviously, you were mentioning, there's a layer of hypervigilance that comes with that, but I'll let you speak to that.
Mhm. Well, I can speak to that personally because I am Iranian and I was born and raised in Iran. And there is nothing as bad as collective systemic trauma because we're meant to experience hardship. Let's say somebody like bullies you at school. They say the most horrible things. You come home and you can reset. Your nervous system can re-regulate. You go back into a state of restoration because maybe you talked about it with your mom and she held you and you cried, right? And she reminded you that you are so loved and you are so safe and that it's going to be okay, right? And actually, children, research consistently shows this. When something traumatic happens, whether it is chronic and global or it is a one-time event like a car accident, they look at the adults around them to determine am I safe or not. So, for example, in car accidents, where a car accident happened and the parents stayed calm, cool, regulated, those children were not traumatized by the car accident.
Mm,
But when the parents were very distressed and dysregulated, the children had a much higher risk of developing PTSD, right?
yeah.
And so that's what's really, really, I think, hard for parents who are in experiencing chronic systemic trauma, whether it is Iran or in our own, Flint or Detroit or Venezuela, is that how do you, as a parent, can tap into that place for yourself so you can give your child that when it's hard. You might have lost sense of hope. And hopelessness is a huge risk factor for all kinds of mental illness, but in particular, suicide.
Mm, interesting. It's interesting too. I feel like a lot of immigrant families that come over to like the United States, for example, and the environment is very different. There's more freedom. It feels safer. And so they give the children this incredible capacity for financial and material stability. But
Hmm.
sometimes there's like this emotional piece that I'm sure is difficult to give because they were in survival mode wherever they were. If they were coming from like a war zone or, sort of a place that was oppressive.
Hmm.
Um, so I guess my question is, how does that person then who feels that they have the capacity for material stability then move into emotional stability as an adult if that wasn't necessarily modeled for them because um the emphasis was on safety, the like the first hierarchy of needs.
You mean survival?
Yeah, survival, yeah.
Well, the reality is that we live in a world that if you have more money and status, you are safer,
Hmm.
right? People, especially as an immigrant, people treat me differently because I have a PhD. I am safer because of that status. Um, in my first marriage, I married somebody who has a French last name. The moment I took that last name, the world became safer. People started treating me differently. So sometimes it's really nothing is black and white. It can be, um, we have to remember that there's a reason why families do certain things, and they are doing what they can, they're giving what they can. And yeah, it can be really, really hard for a family who've been able to offer their children material resources, but they still haven't been able to offer that emotional resources. Yes, that is a real, real thing. Parents cannot offer their children what they cannot offer themselves. And if on the inside, there's still, because there's a really beautiful book called The Body Keeps the Score, that it stays in your body. And so your whole nervous system and brain is still like, threat is on the other side, and I have to stay hyper vigilant, or something bad is going to happen. And this can show up in really kind of like overly criticizing your kids, overly pushing your kids, micromanaging them, or the other spectrum of overly accommodating them, overly coddling them. They're trying to find a way to bring themselves a sense of stability internally. And so if you are an adult listening to me right now, and you're the parent, and this is how you feel, I highly encourage you to make it a major life value to embark in your healing journey where you actively work on healing that trauma and finding ways of bringing yourself a sense of safety, because that trauma can be shed from the body through really incredible interventions that are evidence-based. The brain can heal. We know that. We have research that supports it. If you're a, a person who are an adult who grew up in that household, your parents gave you the best that you could, and they were able to give you some things and not other things. As humans, we all have to do the work. And so you also can have gratitude for what they offered you, and compassion for what they couldn't for them and yourself, use that as a sense of purpose and grow through it. We none of us get a free card of not doing that hard soul work in this life.
Yeah. So, pivoting a little bit, what are some common behaviors that maybe get labeled as defiance or bad behavior, but are actually trauma responses?
And not even trauma responses like your kid had a hard day at school. You know what I mean? Even that. And then they're like, oh, she's so sassy, or he never listens. Like, so it doesn't have to be that. But I want parents to actually tune in to recognize that even on a smaller level, it's this little signal that maybe something systemically isn't working. Okay. Whining. Chronic whining is a symptom of a dysregulated nervous system. Wanting to just say no to everything. I don't want to do that. I don't want to go. I Having that kind of negative mindset. So every time you present the child with something, their first reaction is to kind of say to resist. And this could range again from brushing their teeth and putting their dishes in the sink to starting going to a place they've never gone to before. Um, Shutting completely down. So when you're asking a child questions, they have a really hard time accessing their language and answering it. They have a hard time explaining themselves. Always being very hyper vigilant about, saying, saying no. Because they want to be perfect. They're always thinking, what do you want me to say? And then the other extreme of like aggression and violence and acting out and getting so dysregulated that they might throw things and yell and, you know, other things that we also want to look for are any kind of numbing behaviors where they can kind of check out. And nowadays we're often seeing that with screens. So excessive desire to wanting to be on the screens.
Sure. So, what does effective trauma-informed therapy look like then in neurodivergent kids, but also maybe kids that are dealing with trauma? And how is that different from traditional approaches?
There are amazing interventions to treat trauma in children, like trauma-focused cognitive behavioral therapy, native exposure therapy, EMDR, for example. Um, they all start by the first phase is give a really heavy dose of psychoeducation on what is trauma, how it shows up in the body, how it shows up in our behavior. And you provide that education if you're really trauma informed to not just the child or the person, but also their inner circle. So maybe for an adult, it might be also their spouse. But for a kid, it might be their parents and their teacher and grandma, for example, right? And you want them to repeat it back to you so you know they really understand it. The second phase is to teach them that these things they're currently doing, they're not the problem. It's their way of giving themselves a sense of safety, and they're not working. So reframing the negative maladaptive behavior as a trauma response to bring a sense of stability and especially a sense of control, that can be really, really healing for people. The next phase is to teach them now, what does safety look like? How can we bring you a sense of safety? What do you need to feel that way? For a lot of people, they don't get it. Having a routine, like literally, like the same routine every day, going to bed the same time every day, waking up the same time every day, drinking your water intake, reducing the junk food, um, knowing which conversations to exit, having good boundaries, basic things, just basic overall functioning, reducing screen time, exercise, just exercising that heart, moving that body. There's those basic things, right? Sleep is huge, is the most important thing, actually. And then once we have established all of these things, we move into the active phase of the trauma work where we need to go back to the traumatic event and we need to reprocess it. And you do that in trauma-focused CBT, which is for children, narrative exposure therapy, EMDR, all the interventions. There is an active phase of exposure. It's for people who kind of dissociate a lot. They go back to it. They have dreams. They're always hypervigilant. And that's the hardest part. And for some people, it can be quick. For others, it can be prolonged because of what they experience, more complicated, especially if now, in addition to the trauma, they have OCD or they're neurodivergent or maybe they're also depressed, and medication can be really, really helpful. Um, and then ideally, the last phase is meaning making, helping people to get to a place of, I'm not my trauma. This happened to me or my ancestors, but it doesn't define me. And I have a sense of purpose and I can control my life, and there's so many other beautiful things that are part of my life. So that in whole is what is trauma intervention looks like. Now, if somebody's coming in and they're coming in for something else, and I'm a trauma-informed therapist, I just in general want to make sure they feel safe. Even the way I lean towards them and talk to them and present things to them, and engage in conversation, giving them a sense of autonomy. Like you're always in control here, making sure that they have options, that we go at their pace, that all of those things are a really big part of being a trauma-informed therapist, no matter what you're treating.
Brilliant. Yeah. So if there's one message that you wish every parent of a neurodivergent child could hear, what would it be?
Uh, it's a marathon, not a sprint,
Mm,
because your child's needs will change and the environment's capacity to support your child's needs systemically will change. And so you're just nothing wrong with your child. They just need a very different environment. And the sooner you surrender to reality, the sooner you grieve what you wish it was, the quicker you can move into pivoting, whether it's something like um, leaving the party, that family gathering early because your kid always has to go to bed at the same time, or packing up their food and taking it and saying that you don't have to eat what Aunt Lucy made, or even the schools, a lot of the school setting and like home environment. You have to surrender to the is because the universe gave them to you so that you could lead them in this life in the best way that is meant for their soul journey. They don't belong to you. They were not given to you so you can feel enough, so you can feel loved. It was not for you, you know? And we do all the right things because it's the right way of treating humans, not because then they'll grow up and they'll perform a certain way for you. These are all things that was kind of fed to us, right? And so the quicker we can switch that mentality, the easier it becomes to liberate yourself and your kid in around whether it's advocacy or just that doesn't work for us. I'm not going to do that anymore.
yeah, that's absolutely brilliant. And I don't think a lot of people um, pay attention to the fact that there is a sense of grief because there's, when you have a little baby and when we go into parenthood, I think there's all these like dreams and expectations
Yeah.
and um and then they are their own person, like
Yes.
literally from birth. I mean, I feel like,
Yeah.
my nieces and nephews, they were like them the second they
Yes.
were born. Like the way they were born, they were them. And
Yeah.
and there is, when expectations and reality don't, you know, meet essentially, right? Then you kind of have disappointment, but maybe reframing that as, like the way you said it was absolutely beautiful. It's your responsibility to help guide the soul on their soul journey as the parent and not necessarily to project your own needs and desires onto them
Yeah.
as a reflection of yourself.
But it's so also so normal. And so the way we cope with that is by I talk to myself. I say, hey, I get it. There's a part of you that wants that was fed to you through TV and everything else. And or maybe it just feels pretty in your head. And I get it. Like you want that. And you deserve that. And it's not your reality. And that is also okay, you know? And so I learned how to talk to myself, and that really, really helps. And I also talk to myself that this is not a my child issue, it's not a me issue, it's a systemic issue. If we had healthcare providers that knew how to care for all people, not just neurotypical individuals, not just people without disabilities, not just people um, who are your average folk. If we had school systems that supported all learning styles, if we had work settings that supported all performance styles, right? That
Hmm.
we wouldn't be even having some of these conversations. Now, um, I mean, there are children who have a lot of special needs because of health conditions. But again, even that's a systemic issue in the sense that there isn't systemic respite care built into our communities. There's still a lot of like everything's placed on the mother. Insurance, healthcare costs are really high. Insurance only covers so much. So that helps me remember like we're part of a bigger system and some things are meant for us, something is not working for us, and that's real. I can only do so much.
Yeah, brilliant. Thank you. I'm so, so grateful that you came on and shared your expertise. I hope we do this again because there's a million other topics I want to talk to you about.
Yes.
But thank you so much. This was amazing.
Thank you for having me. Thank you.
Thank you so much to Dr. Hasti Raveau for joining me today and for sharing your insight, compassion, and expertise. This conversation is going to help so many parents feel less alone and more empowered in supporting their children. And as always, thank you to everyone listening to Sage Connections. If you enjoyed today's episode, please subscribe, share it with a friend, and leave a review. It truly helps us grow this community. Until next time, take care of your health and your wellness.